Hello everyone, my name is Mitali Parihar and the topic of my pedagogy is tetanus. Tetanus, which is also known as the lockjaw, it is an acute infection that affects the nervous system causing severe and painful muscle spasms. It is caused by Clostridium tetani, which produces a powerful neurotoxin. It enters the body through any wound, even a minor cut or a scrape.
Now pathogenesis.
The spores of the Clostridium tetani are present in the soil. They can enter at the site of the wound. After entering at the site of the wound, the spores germinate in the necrotic tissue where there is poor oxygen supply. Poor oxygen supply is the favorable environment for the spores to germinate because Clostridium tetani is an anaerobic bacteria. After germination, it produces the toxin. Toxin, also known as the tetanospasmin. The toxin moves retrograde along the nerve and reaches the CNS. After reaching the CNS, it binds to the ganglioside receptor of the neuron. After binding, it blocks the release of inhibitory neurotransmitters, and that is GABA and glycine. It causes the continuous muscle contraction and therefore spastic paralysis. Clinical feature. The first sign. Incubation period usually 3 days to 4 weeks. The classic first sign is trismus. The spasm of the masseter muscle making it difficult to open the mouth. Other early symptoms include neck stiffness and difficulty swallowing. Severe spasm. Rhizus sardonicus. It is a characteristic facial expression caused by sustained contraction of the facial muscles. Opisthotonus. It is a dramatic arching of the back and neck due to powerful spasms of the back muscles. Spasms are extremely painful and can be triggered by minor stimuli like noise or touch. Types of tetanus. There are 4 types of tetanus. First is generalized, second is neonatal, third is localized, and the fourth is cephalic. First, generalized tetanus. It is the most common type. It usually starts with the trismus and then progresses to the difficulty in swallowing and stiffness or pain in the neck, shoulder, and back muscles. The above discussed features of the severe spasm are also included in the generalized tetanus, Rhizus sardonicus and opisthotonus. Second is neonatal tetanus. It occurs in the newborn babies, typically due to the unhygienic childbirth practices. It is extremely dangerous with a high fatality rate, about 80 to 90%. Localized tetanus causes muscle spasm only near the site of the wound. It is uncommon and generally less severe compared to the generalized form. Cephalic tetanus. It is characterized by lockjaw and facial nerve palsy. It mainly affects the head region and involves cranial nerves. Treatment. First, we have to eliminate the source by cleaning off the wound thoroughly and giving the antibiotics like the penicillin or metronidazole to kill the bacteria. After that, we have to neutralize the toxin by administering the human tetanus immunoglobulin TIG to neutralize any circulating toxin that hasn't yet attached to the nerve tissue. Control of the spasms. Use sedatives and muscle relaxants to manage the severe spasm and reduce pain. Supportive care, manage breathing, nutrition, and other vital functions. Prophylaxis. The best way to prevent tetanus is through active immunization. A primary course of 3 doses of triple vaccine, that is DPT, is given in the first year of life. Subsequent booster doses or TT injections are recommended at a school entry and then every 5 to 10 years. For unimmunized individuals with wounds, an anti-tetanus serum or tetanus immunoglobulin should be given. Thank you. Have a nice day.